Good morning, everyone. I am Megan Rogers with Indiana SHIP, the State Health Insurance Program, and I am joined by my co-hostess this morning, Melanie Garland in Southern Indiana, and I'm up in the northern parts. And we are here for our last live for January. I can't believe we're already moving into February. That's crazy. And we are here today to talk about services that SHIP provides throughout the whole year. We aren't just here for fall open enrollment. We do other services throughout the year, so we're going to chat about that. We do have a special guest with us this morning, but before we introduce her, I'm going to pass it over to Melanie to get us started on our topic today. Good morning, Melanie.
Good morning, Megan. How's the air up there, up north?
Oh, we're going in for a heat rave, I think.
Oh, yep, here too. Absolutely. I love seeing the sun and that it's actually a little warmer out. So,
Exactly. Yes.
all right. Well, good morning, everyone. Thank you for joining us. And we will be monitoring the comment section on this video. So if you have any questions or you just want to say hi, please do so. And we'll do our best to try to answer those questions in live time. So I think Megan will be monitoring those for us. And we're going to move along with ship services offered year round. And we thought, what better way to talk about ship services offered year round without having one of our awesome ship volunteers join us today. Okay, so let's talk about the different ship services that we do offer throughout the year. But before we dive into that in depth, I do want to just kind of give a reminder of what ship is. You might follow us, or a friend might have told you to watch these videos, but just kind of a quick refresher. We are a free impartial counseling program for folks with Medicare. We're provided through the Administration for Community Living. You might have heard that referred to as ACL. We like to, acronym all those government initiatives and programs. And then we're also housed within the Indiana Department of Insurance, and we are part of a federal network of state health insurance programs located in every state. So maybe you found and happened upon us here in Indiana, but you may live in a different state, and there is a SHIP state a SHIP program located in every state. And the reason for our existence is to be that impartial and free resource for you to understand your Medicare options, to have assistance if you have a problem with your coverage, or you don't know where to go to enroll, or how to figure out which plan is right for you. So those are just kind of a small part of what we can do and how we can help. So what we want to talk about first is kind of the backbone of our program, and that's our SHIP counselors. So our SHIP counselors are certified by a very almost like our initial SHIP counseling training is kind of a Medicare boot camp, so to speak. So we go through all the things that you need to know about Medicare to be able to educate and counsel others on Medicare and their options, how to navigate different things that may be problematic with folks on Medicare, how to help, how to be an advocate. And our SHIP counselors, I mean, they just have a heart of gold. They want to help others. They want to be able to be that resource where folks can come to them and meet with them. So most of our SHIP counselors are going to be located at SHIP sites or enrollment centers. And these are organizations and companies that have signed up with us to be a location where someone can go and get SHIP counseling. And then that service is provided by our certified counselors. And most of them volunteer their time. And some of them, we kind of call them our voluntold. They may be employees of the organization or the company, but they're doing those SHIP duties in addition to their regular job duties. So we really appreciate that volunteerism as well. So before we move on, I want to introduce Cheryl. So she is one of our SHIP counselors. And Cheryl, if you want to just kind of hop on here and just tell us a little bit about yourself.
Okay, well, I hope that's better. I hope you can hear me now, Megan. Sorry.
Absolutely.
So a little bit about what I do is I am a ship counselor. I volunteer my services um, uh, at Bridges to Health in Marion. It's a free clinic. It's an enrollment center. So, like you said, there's different places where people can meet us, or they'll call the ship 1-800 number, and I get a lot of referrals that way where people just want to meet one-on-one or face-to-face. So they're not real comfortable with technology, but I am a ship counselor, and I also am a little different. I am a navigator for the Indiana Department of Insurance. I'm also a certified community health worker. So I do have a full range of assistance that I try to offer for people, and but ship is my passion. It is that.
Awesome. Well, thank you for joining us today, Cheryl. So,
You're
how long
welcome.
have you been a ship counselor?
I've been a ship counselor now for 6 years.
Oh my goodness.
Yeah.
Okay. And so you're at Bridges, and so you're able to take appointments for people that need help. Can you give us like an example of one of the appointments maybe you have during the year, outside of that fall time?
Yeah. Well, a lot of time I think really key is just like people who are working, continue to work, and then all of a sudden they're at retirement, and again, what happens after retirement? I know I'm eligible for Medicare, but what does that mean? And how do I choose my Medicare? I mean, a lot of people have the misconception that it's just one way and that's it. I don't have a choice. So
Right.
just educating them for like if they're leaving the workplace. Also, I deal a lot with people who have Social Security disability who become eligible for the very first time because they're not 65, but they are eligible for Medicare because of their disability. I also have a lot of people who are dual eligible Medicare and Medicaid, and that program is changing a lot with Pathways. I'm seeing a lot more inquiries from people about that program. So those are just some examples. Or like for instance, my mom is, she's been on Medicare for a long time. Now we now have to change her living situation because either it's medical or it's behavioral or it's not safe. I mean, so again, I just see so many situations. But yeah, a lot of it does come during open enrollment. And then, of course, I'm seeing a lot more of that general enrollment for the Advantage plan. That's very confusing for a lot of people.
Yes, it can be for sure. Well, you can find local Medicare experts like Cheryl, and other volunteers throughout the state. I think we have around a little bit over 400 counselors statewide. And so the way that we are able to help you find a local SHIP counselor in your area is you can call our SHIP helpline, and our customer service can locate you, depending on where you live in the state, to a local SHIP counselor or site or enrollment center where Cheryl is, to connect with a local SHIP counselor in your area. We also have a website with a SHIP locator on it as well. So you can go to our website. It's medicare.in. You got to remember that IN part, medicare.in.gov, and you can find resources on there as well as our local SHIP site list and counselors, or where you can find a SHIP counselor at those sites. All right. So we kind of talked a little bit about the different services that we can offer throughout the year, but we want to kind of also talk about how a SHIP counselor can help you. So SHIP counselors offer one-on-one counseling, and this can be in an in-person setting at their counseling site. Sometimes we get out into the community too. We have events outside of our organizations or where we're at. You may see us at libraries or senior centers or, oh, I don't know, ladies. I've had a counselor counsel at McDonald's before, so you just never know where you may see us pop up and have an appointment. But we are typically at our sites, and that's because a lot of our sites and organizations, they set aside office space and accommodations to be able to offer private and confidential appointments, and then all of them are personalized to fit your needs. So if you've joined us in our presentations before, you've probably caught on to the theme that Medicare is not a one-size-fits-all. So these one-on-one counseling sessions really are meant to meet your specific situation and your specific need and to help you. And these counselors are trained. They're initially trained, and then they also have trainings twice a year where they get update trainings with us, and they're up to date on any changes and new information that's coming along, or different coordination of benefits. Like Cheryl mentioned, there's been some changes recently to help people navigate a different coordination of healthcare like Medicare and Medicaid. And so then obviously, these appointments are also free and impartial, and you can trust the information that you're given. And then we learned a few lessons during the public health emergency. We learned that we can still reach people even if we can't be with them. So we added virtual appointments to our lineup of services. So you can even meet with a SHIP counselor, kind of like how we're meeting today. So Cheryl and Megan are not close to me in location at all. I'm all the way down here in Evansville, and they're in the central and north parts of the state. And so but it kind of feels like we're hanging out and having our coffee this morning together. So, and we can do the same thing for a counseling appointment for you. The other thing that is nice about the virtual is it's really good for caregivers as well, or family members. So if you're helping a loved one with their Medicare and you want to meet with a SHIP counselor, and you may not have the time, but you are more tech savvy or you're more comfortable with the Zoom appointment, we can help you. Just recently, I met with an adult daughter, and her father was recently moving to Indiana, and she was in Colorado. And so we talked about the options for health coverage and the plans and the different things that he would be eligible for. And we were able to do an in-depth appointment without her having to hop on a plane and come to Indiana. All right. So then some of the services that SHIP counseling can help with, we've kind of touched on open enrollment and in the fall. And I think we're all kind of recovered from the busyness of the fall open enrollment season. But during that time, it's an especially busy time because anyone on Medicare can make changes to their Part D coverage. So they can choose to stay with original Medicare and have a drug plan, or they can choose to have a Medicare Advantage plan, or vice versa of that, maybe be on Medicare Advantage and choose a drug plan. So our counselors are busy going over the options and helping people compare their plans and coverage, and just making sure that they feel comforted and educated in their choices for the following year. So that's the time where everyone can make changes. But there's still things that SHIP counselors can help you with throughout the year outside of that Part D open enrollment period. So right now we are in the middle of the Medicare Advantage plan open enrollment period. So that's for folks that are on Medicare Advantage plans. And if they may not be happy with their plan, or they're looking to make a change for whatever reason, they can change from Advantage to Advantage, or they can drop their Advantage plan and return to original Medicare by picking up a prescription drug plan. And so those Part D plans, whether they're a prescription drug plan or a Medicare Advantage plan, our SHIP counselors can help with those enrollments, the comparisons, and educate you on the coverage options. And, life happens throughout the year. So maybe you got a new medication that your plan doesn't cover. SHIP counselors can help you navigate and problem solve, and maybe see how you can get coverage in other ways, or talk to you about your plan and options that you have to maybe try to get an exception for that drug coverage. There's also special enrollment periods, just like that person I talked about that was moving from here to Colorado, or from Colorado to here. They have a special enrollment period to make some changes to some of their coverages. So those are some of the topics that SHIP counselors can help with. And maybe you just don't understand your plan, or you don't understand your coverage, or you got a bill that you're not sure about, or you want to make a claim and you're not sure where to start, or you're unhappy with a service that you received and you want to know how to, contact your plan or your coverage. Our SHIP counselors Also put on an advocate hat too, so they can help you understand your coverage, understand if there's anything you can do, help you with the action steps, and just learn more about what's available to you at this time of the year. Sometimes we meet with folks, we cannot make a change for them, but just by educating them on what they currently have and why they currently have it and when they can make changes, that's still helpful. So, ladies, I'm going to kind of open the floor and let you share some stories of different situations you see throughout the year that we help our Medicare beneficiaries and their families.
Well, I think one of the situations that I really remember is, I had a lady who came to me who had a huge bill. And you were talking about access to how do they understand the bill? How do they, I don't know why I owe this money. Why didn't Medicare take care of it? And her daughter came with her because daughter was a caregiver, like you mentioned before. It's just not the person who has the benefits, but it's definitely, a family. One of the things I always suggest, even when I counsel with someone and if they're not tech savvy, is I try to help them create their Medicare.gov site. It's really important, I say, because it's an access of tools. You don't necessarily have to be with me, but I can also just walk you through it. I can see what you see on a screen, or you can look at your claims. You can find services. You can see what kind of plan you have. There's very helpful tools there. So I talk about Medicare.gov a lot, and trying to help them initially, or even if I meet with them, I said, this is yours. This is for us, for me, because I'm a senior and I'm on Medicare, and I use this site quite often, even of my own personal life. So that was one situation, and it just when they saw it, when the senior saw it, and my client and her daughter saw this, they're like, "Oh my gosh, I had no idea that there was anything like this. This would have been so helpful for us, especially like find a provider in our plan, or are all my medications covered?" And I also say it's not just now, but in the future, this is a really great tool. So that's one situation. And then, like, I've had several recently with how the economy is changing, where they're retiring now. Maybe they're not, they're past 65, they haven't enrolled in any Medicare. How do I do that? What are the steps? So it's just those kind of things. It's not just open enrollment, as you said, Megan, or during this general enrollment period, but life is very busy, and people just want to make sure they know who is, who can they go to without feeling like we're trying to sell them something. I hear that all the time. But I said, I'm here to educate you. I am not trying to make your decisions for you. I just want you to know when you leave my door, you feel like you have a very good idea of what is available to you. And I think they feel very relieved about that once they hear that you're not trying to sell them something.
Absolutely. Yes. Megan, what about you?
Well, this one actually happened last week. So most of the viewers may know or remember that we did a live last month about a new rule in Indiana that individuals under 65 can get a Medigap supplement. And since that is new, we are having some hiccups with our insurance companies understanding this rule. And I started working with this couple last month. He's in his 30s. He's paralyzed. He's on Medicare. He was on Medicaid, but due to income and resources, he moved to a lower level of Medicaid. So his out-of-pocket costs are not covered anymore by Medicaid. So for his health issues, they determined they wanted a supplement for him. So I provided education, and the girlfriend, was very independent, so she started contacting insurance companies. Fast forward to beginning of January, and she let me know that they were still having some issues. So I gave her the name of the new law and keywords to use with the insurance company. Fast forward to last week, she let me know the company that they tried to go with they did medical underwriting on him, which they technically can't do right now for the first 6 months of the year due to this new law. And they denied him. They wouldn't sell him a policy. And she gave them the name of the rule, and they still said, we're not going to do it. So I asked for some contact information for the insurance company, and I provided that advocacy piece. And I sent an email to this insurance agent giving them the details. And lo and behold, 2 hours later, he had a policy. So, that's a big piece of what we do. We want our individuals to be as independent as possible. So we're going to provide that empowerment and education piece. But when that's not enough, we will step in where we can to try to help. So I'm very happy that that worked out for them. And, that's one of the things I love about doing SHIP is helping them get what they need.
Absolutely. That's a great example. And so, yes, some of the new changes or coverage options just went into effect 27 days ago is that folks that are on Medicare and under the age of 65, they now have new guaranteed issue rights to get a Medigap policy. And since it is new, not all of the kinks have been worked out yet. So it's nice to have SHIP counselors and services that can help you get what you're allowed to have because it is so new. So that's a great example. Thank you for sharing those stories, both of you, Cheryl and Megan.
Welcome.
Now we're going to talk about other ways that SHIP can help. So outside of those one-on-one counseling appointments, and I like to say our SHIP counselors are the backbone of SHIP. They keep us upright, they keep us afloat. No pun intended there. But we are so grateful for our SHIP counselors and all the work that they do. And some of the other ways that SHIP can support Medicare beneficiaries statewide and support our counselors is our SHIP call center. So we have a 1-800 number. It's 452-4800. And that gets you to our main central office, and we have folks that work those phones and they can offer you resources. They can do quick counseling over the phone with you. They can help you problem solve or get into the right hands, so to speak. And sometimes getting into the right hands is finding a local SHIP counselor that can meet with you in person or maybe provide more localized information to you. So one of the great things about SHIP is we do try to be local. So we do try to have folks that understand your area and understand the services and things that can help incorporate your Medicare. So like Cheryl mentioned, she does so many other things outside of SHIP, but that really helps her as a SHIP counselor too. So you may be there for Medicare, but then you may learn more about other resources in the community as well. So we're very thankful for that. And then our SHIP call center, you can also call and talk to a staff person or even press a few numbers and you can get some mailed resources to you. So we have like your new to Medicare packages, which have different information about Medicare coverage options and what this means and what this plan means, so that you can kind of start from somewhere to know where to start with your Medicare. And then we have other things like our Medicare savings programs. We've talked about that. And other information that can help you as well, like our long-term care services in Indiana, and long-term care insurance, I should say, in Indiana. And then our online resources as well. So if you're watching us today, then you probably follow us on Facebook, but we are on social media. So we're on X and Facebook and LinkedIn. And then a lot of our videos that we do on our Facebook Live, they travel over to our YouTube channel as well. So we do have a YouTube channel with information on that. And I mentioned our website earlier, but our website, it does have a local SHIP site locator on it, but it also has online materials. So a lot of the materials that we use as SHIP counselors that our help center can send you, they're also available online. So you can read them online or you can download them and save them. So however you like to receive information, we try to make that available to you. Another item and tool that is useful is our Medigap comparison tool. So we A website, yeah, and it's public, so you don't have to be a SHIP counselor to use it. You can go to our medicare.in.gov website, and under our Medicare and Supplements tab, you can find our comparison tool. So this helps you find different companies that sell different types of Medicaps in your area, kind of get an kind of a ballpark on the pricing, the availability. You can even look at things like how they change their pricing over the years, just all kinds of different analytic data that you can look into to kind of make your choice more informed for your Medigap tools. So that's something that I really like showing clients when I meet with them too. All right. So then I'm gonna kind of open the floor again here. So we love doing outreach. We love doing presentations. We love doing public speaking, and we do it in a unique way sometimes. So we were just kind of chatting before we got on, and it hit me that we've been doing these Facebook Lives for almost 5 years now. I think we started in April of 2020. So time flies when you're having fun. But so that was kind of a unique way to reach people when we couldn't be in person. But ladies, can you share with us some of your experiences where you have shared or have done different public speaking or presentations or maybe a unique health fair where you've reached folks? Go ahead.
Well, this recently came to mind. I am doing a nutrition class, and I was invited by one of the affordable housing agencies to one of their facilities. They have 131 either elderly over 62 or disabled. So they asked me if I could come and speak about nutrition, and I said sure. And I said, well, you don't mind if I talk about some things that are important. And like one of them is, what would you do if you had more money? And one of the things I like to incorporate SHIP in is that we're just looking at the entire community, trying to relate to them. And in this setting, how many people know about the Medicare Savings Program? And it's still surprising to me that a lot of people don't know what the Medicare Savings Program is and how that can help them. And in this case, I said, well, if you have more money, you can afford healthy food, and you can afford to buy more food if you're on a income. I mean, some of these are people that have $600 a month. That's really not a lot to live on. So, and didn't even know what a Medicare savings program was. And so I find that very surprising and also really exciting, because when they do say, oh, I'm getting, they're going to pay my Part B premium, and that means I can do this, and I can buy, and for me, that is just wow, fabulous. So yeah, I got to go out into a community in a setting where it's very different. And then also, one of my favorite outreaches is the stand down for veterans. That's one of my favorite.
Yeah, tell us a little bit about that. I don't know if all of our audience knows what the stand downs are.
So every year, typically from October to probably the end or middle of November, every community has what they call an outreach or a military stand down. It's sponsored usually by the local Veterans Administration officer in every county, hopefully, and sometimes they combine counties depending on the size or the population. So it's directed at the veteran population. So they invite veterans and their families, their spouses, whether they're deceased. I mean, as far as their spouses being deceased, if in any way, shape, or form that they are touched by the Veterans Administration. And so one of my favorites is that one, because I hear a lot about not being able to get some of the services because of availability or transportation, and then helping them understand that I'm so grateful they have veterans benefits, and that's exactly what it is. It's benefits. It's not insurance. So talking about, do you have your Medicare? Why, if you do, great. Do you understand it? Are you happy with your plan? Do you understand the difference between your benefit and having your health insurance? And if they don't have it, there's a lot of things that you want to share with them right away, but typically I encourage them to come in and have just a conversation. I'm not trying to convince them of anything or make them change or give up their benefits. It's just, can we just have an honest conversation privately where we can talk about, have you thought about this situation, or have you thought about this scenario, or what happens if you can't get to the VA facility, or those are just things and what Medicare can do for you. So as a person who is, either documented disabled, or if you have, if you've never enrolled in Social Security or Medicare, if you don't think that that's something you need. So that's one of my favorite. And every year, I've done it now for 6 years as a SHIP counselor there with SHIP, and many great counselors have helped me. And been there with me and supported in terms of, hey, are you happy? Do you understand your benefits? And every year I'm surprised, just totally surprised about how much they don't know, or how much they don't understand. So that's one of my favorite. It is one of my favorite.
Absolutely. Yes. And those are right around the corner coming up. So
They
uh,
are.
absolutely. Well, thank you for doing those. And outreach it's really what it sounds like. We're trying to be out into the community and reach out to folks that may not know about assistance that's available to them, and letting them know where they can get help and assistance. And like we've mentioned before, we're not selling you anything. We're really here to make sure you have what you need and that you understand, and then to provide assistance to help you get what you need if we can. So, Megan, what about you? I know you've done some interesting presentations and locations and things like that.
Yes. So one thing that we do throughout the whole state is our Medicare bingos. And I love doing the Medicare bingos. We educate people while we have fun, and there's fun little prizes, and it's just a good way to sneak in some outreach and some education while playing a game. We've also done a few of those at McDonald's, and I think we've called those Medicare McBingo at McDonald's. It's a mouthful, but it's fun. And this one isn't extremely unique, but one of my favorite presentations that I do is geared towards caregivers. Maybe they're not on Medicare yet, but it's for individuals that are supporting and providing care for loved ones that are on Medicare. So, what caregivers need to know about Medicare. So, we talk about things that they should do when they take over being a caregiver, things that they should have copies of, things that they should be aware of, like Social Security doesn't honor power of attorney documents. That's a big one that most people don't know. So if a power of attorney tries to call Social Security on their loved one's behalf, no one's going to speak to them. So the loved one needs to be on the phone as well. So that's just one that speaks to my heart. I love working with caregivers. I'm a caregiver myself. So that's just one of my favorite ones to do.
Absolutely. Thank you for sharing. Yes, we do presentations all the way from, professional groups to reaching out to. One of my favorite events to do here in Evansville is we have a homeless care connect. So it's a big health fair. There's so many different organizations and agencies and it's not just for homeless, but it is targeted to the homeless community, and then others that just need to find some assistance and help. There's local barbershops and um, hairstylists that offer free haircuts. The BMV is there, Social Security is there, we are there, and there's just so many other organizations that I can't even think of. But it's really just kind of a one place all to where you can get different services and things that you need to get. So I love doing that health fair, and I always try to see how many Medicare Savings Program apps I can get done when I'm there.
Mhm.
So it's kind of a silent competition I have with myself each year, but it's fun because I just love to reach out to those folks that may not know that things can help them exist that can help them. And then, we're available for professional groups, and we go to employers and different companies and offer presentations to help people understand what happens when they retire, what happens when they turn 65, and how to be prepared. So we really try to hit, all scales, and really provide that service statewide to all folks that need it. So thank you for sharing. And I think unless you ladies have other things to add, I think that concludes our presentation for today. So thank you for watching. If you have any questions, we still monitor these, so please go ahead and put them in there, and we will answer those. Deborah, I see you on here, retiring in 4 months, so congratulations for that, and can't wait to see how your SHIP appointment goes as well. So I hope it's a great resource for you. And Megan, I'll let you close us out.
All right, thank you. So we are moving into February already, and we have a great lineup in February for everyone. So we're going to start our Medicare Mondays with talking about medications not covered by your Part D part of your Medicare insurance. So learning how Medicare covers medicine, how it doesn't cover medicine, how you might be able to get some help with medications that aren't covered by Medicare and so forth. So that will be a great topic to tune into. Our What to Know Wednesday is right around Valentine's Day. So we are going to give our shout out to our SHIP counselors and show some love and talk about what they do in their area, what they like being SHIP counselors, and some of their stories. And then we're going to wrap up February with talking about the new Medicare prescription payment plan. So if you're on some expensive medicine, how you can kind of even out those payments. So instead of paying $600 at the pharmacy, you might be able to split that through evenly throughout the year and pay directly to your insurance company. So that's new this year. So we're going to talk about what it is, what it isn't, and how it's going so far. So that is our lineup for February. So thank you everyone for tuning in. Cheryl, thank you again for joining us and sharing
Thank you for
your
having me.
stories. Oh, you're
Thank
welcome
you.
anytime. Thank you for everyone that tuned in, either live or watching the recording. And like Melanie said, we do watch that chat box after the fact. So if you do have comments or questions, put those in there and we will return those questions as soon as we can. So thank you, everyone, and have a great week.
Absolutely. Thank you. Bye-bye.
Bye. Thank
Bye.
you.